Welcome to the Monash Health 2021 Length of Service Awards. Congratulations to all our employees and volunteers who have achieved significant career milestones this year. This year, we recognise over 1,500 people who have made a lengthy and meaningful contribution to Monash Health, and tonight we focus on our 15-year volunteers and employees. And the most important thing I want to say to you all is thank you. In a remarkable achievement, we have two people who have reached the milestone of 55 years of service this year. I'll have more to say about them a bit later, but before I do, let's take a moment to take a trip back to the 60s, to the start of their careers, and reflect on how far we've come. And then we'll hear from the Monash Health Board Chair, Deepak Songvi, with an important message.
I am Deepak Sangvi, Chair of the Monash Health Board of Directors. I'd like to begin by acknowledging the traditional custodians of the land, the Wurundjeri and the Bungarong people, and pay my respects to them, their culture, and their elders past, present, and emerging. I'm pleased to be with you today to celebrate and acknowledge your years of service. Congratulations to you all. It has been a year like no other. As the health service responded to the COVID-19 pandemic, you have adapted continually. I'm proud of every member of our Monash Health team. You continue to deliver the best of care under the most challenging times. You have shown outstanding resilience, commitment, and dedication. Today's event will celebrate your incredible contribution. Each of you has a different role, whether it is greeting patients, keeping our health services clean, preparing meals, working in our labs, or delivering the best healthcare to our patients. You make a real difference in the lives of the real people. The news headlines focus on the big outcomes and big statistics. But every day across Monash Health, there are small acts of kindness and care. These acts makes all the difference to your patients and your colleagues. Working in health is like no other job, and by choosing to be here, you have shown you are committed and caring. As you continue your life journey, I hope you will reflect with pride on the difference you have made to people's lives. The difference often comes at the greatest time of need. I'm excited by the future and hope you are too. We are always looking to grow and improve our care to the community. We have the vision to be a leading teaching and research health service of international standing. I'm confident we will achieve that vision because of you. Enjoy your celebration. You have earned it.
Here we need people who share our vision. People like you who have shown years of commitment and dedication. All of you influence how a patient or consumer feels when they are in our care and what they remember about their time with us at Monash Health. I want to mention Helen Gilbert, who started her Monash Health career as a lab scientist at the Queen Victoria Hospital on the same day decimal currency was introduced in Australia, Valentine's Day 1966. And Marilyn Lewis, who in the same year answered an advertisement for a secretary at the Mordialloc Cheltenham Community Hospital and still today is working at the Moorabbin Hospital. These are the two longest serving employees our health services had the pleasure of recognising. These length of service events tell us a lot about our organisation. They tell us about our people, the intangible essence of a health service, which offers so many experiences to grow, change, learn and challenge and be challenged, both personally and professionally. Over these 4 events, we'll hear from a number of different people. A nurse in charge who has worked night shift at the Dandenong Emergency Department for 35 years. A pharmacist who, with a focus on antimicrobial stewardship and is on secondment from the Doherty Institute. An outstanding neonatologist, a person who has helped her team safely navigate the cleaning and food service delivery during the pandemic. A Casey Hospital volunteer of 15 years commitment, and a member of the Victorian Honours Roll, who has been guiding Victoria women on the care of their health for over 25 years. An ICU nurse manager who's turned his considerable skill and knowledge to helping manage the flow of clinical products from the Scoresby Distribution Centre to hospitals across the state, and so many more people. We've always known that Monash Health is made up of many great people doing important work, but that has never been more obvious than during the pandemic. The challenges and the risks have brought to the fore everybody's strengths, skills and expertise. In the past, the community might not have given much thought to the lab technicians or the pharmacists or the many people behind the scenes making the organisation work and what it is today. They might not have thought about the employees who manage infection control or source PPE. They might not have thought about the many cleaners and support staff in our organisation. The COVID-19 pandemic has changed how we operate our health service and has affected us all, personally and professionally. And of course, it affects tonight's event, which we're again running virtually to keep everyone safe. Let's hope we can all get together next year and through these challenges, continue to adapt, innovate and deliver safe and high quality care. And of course, I'd like nothing more when we get together again to shake your hand, but we'll wait a little bit longer for that. This year, our daily work has been in the spotlight. The community tuned in to the work of hospitals and health services. The public, every day, was waiting to hear on the infection numbers, wanting to know how many patients were in the hospital, the ICU numbers, how many people on ventilators, and what was coming next. People wanted to know, how does contact tracing work, and how many more vaccines need to be delivered before we hit the all-important milestones, like the one we'll hit this weekend. You've already shown how adaptable, flexible, resilient, and caring you are. And I think it's those characteristics that are probably what drew you to the health sector in the first place. And while working during a pandemic is extraordinarily challenging, it is something that I think will strengthen you in so many different ways, and certainly something both you and I will never forget. While the COVID response has dominated this year, Monash Health has continued to care for all of our other patients as much as we can. We've also seen some exciting progress on some major projects that we look forward to. The Victorian Heart Hospital, which is due completion late next year. The government committed to building a new facility at Kingston Centre, a new residential aged care facility. We've opened part of our new emergency department at Monash Medical Centre and hope to open the second part of that, so it's fully operational by the end of this year. And of course, the beginning of last year, we fast-tracked the opening of the new ICU at Casey and the new tower, all in preparation for COVID-19. Thank you for coming to work each day and for providing the great service you do for our community and for supporting each other. Thank you for choosing Monash Health to be your place of work. So tonight, to read the names of those being recognised for their dedicated service to Monash Health, I've joined by a number of members of our senior leadership team. Stuart Donaldson, our Chief Finance Officer and Executive Director of Financial Services. Louise Canis, our Executive Director of Public Affairs and Communication. Professor Rhonda Stewart, our Medical Director of Infection Prevention and Epidemiology and Director of our Public Health Unit. And Martin Keogh, our Chief Operating Officer. But for now, I'd like to invite Stuart, our CFO, to announce our 15-year Length of Service Awards for volunteers. Over to you, Stuart. Love the background.
Thanks, Andrew. Hi all, Stuart Donaldson here, Chief Financial Officer for Monash Health. As always, I'm delighted to be here to celebrate the Length of Services Awards at Monash Health and the outstanding contributions made by a number of individuals. Tonight, I'm reading out the 15-year, that's right, 15 years, what a great achievement, volunteer awards. And the recipients who've given up their own valuable time for Monash Health are David Blanche, Patricia Blanche, Sylvia Giles, Elaine Hughes, and Brian Oates. Congratulations, everybody, and thank you for 15 years of voluntary service to Monash Health. Back to you, Andrew.
Thank you, Stuart. As we move through tonight's ceremony, we'd really welcome hearing from you on Slido. And you're all familiar with how we do Slido, so on your computer or your phone, enter MHLOS 2021, so Monash Health Length of Service 2021. And you can find the details on our website or our Facebook group. And our first question we'd really like to hear from you on is, you've travelled back in time to your first day at Monash Health. What would you tell yourself on that day? Tell us your thoughts on Slido and we'll check in on them as we go through the ceremony. And I can see one comment here. I remember the painting of Queen Victoria at the old QV hospital. Saw it again in the Lecture Theatre 1 at Monash Medical Centre. What a journey the painting and we've had at Monash have all had. So one of the things I like to do, as some of you know, is chat to some of our guests, some of our Length of Service Award recipients. And tonight we're going to hear from Elaine Hughes. Elaine has been a constant presence for the rehab patients at Casey Hospital since 2006. She loves chatting to people and aims to find a connection, whether it's in gardening, reading, movies, pets, and her beloved hawthorn. Congratulations on your award, Elaine, and welcome.
Hello, it's lovely to be here. Thank you for inviting me.
Now, Elaine, I thought when I was made Chief Executive that I'd issued a direction that only we employed Richmond supporters, so I see you're a Hawthorn supporter.
Yes, my husband and I came to Australia in 1969, 19th of August 1969, and were put overnight in a hostel in Hawthorn, and our first experience of Australia really was a wander down Glenferrie Road, Hawthorn. So it was the best reason we had to become Hawthorn supporters, and we've stuck with it ever since.
And what a great couple of, what a great last decade the team's had as well, and you as a supporter.
Absolutely.
Do you remember your first day at Monash Health?
Yeah, my first day at Monash Health, I started as part of a team to help in a falls prevention program. So they set up a 6-month trial in 2006, I guess, and yeah, I was part of that team. So okay. Yeah, it was an interesting time.
And I understand one of your favourite reflections is with another fellow Hawthorn supporter that you got to meet.
Yeah, I've volunteered in the rehab wards, Ward D and Ward H, for the whole 15 years. And we get mostly older people, of course, in rehab. It's just a fact of life. But one day I went in, there was a young 18-year-old. He'd just finished his VCE and was getting ready to go off to uni. But he was dying. He came down over Christmas with the Guillain-Barré disease that Alistair Clarkson had had. And when I go into a room, I try and look for something, you know, to connect me, especially with young people. And there on the wall behind him was a postcard of the Hawthorn team. So this was great. It gave me an intro, you're a Hawthorn supporter. Oh, yes, so am I, blah, blah. And I tried to, encourage him and chat to him. And he was such a gorgeous young man. And I had grandchildren of a similar age at the time. So I felt I was able to talk to him, especially about sport and stuff. But I went home thinking, Alistair Clarkson had this disease. How can I get in touch with him, maybe, to come and talk to this guy? I just felt it would help him. So at the time, I was a member and part of a supporter group. And I used to email and text Jazz, who organised supporter functions. We used to go for a dinner once a month. So using the same type of script, I sent an email to Alistair Clarkson, not knowing that if it would get to him, but I used the same sort of address and sent off an email telling him who I was, what I was, and about this young man. Never, of course, heard anything and thought, well, nothing will happen, but however, I gave it a try. To my delight, when I went in the following week and said to this young man, how's your week been? He said, I've had the best week ever. You'll never guess what happened on Wednesday. And I said, what happened on Wednesday? He said there was a knock on the door and there was Alistair Clarkson. He came to visit me and he had a picture of them on the wall. It was just amazing for me. It was a wonderful story and I was so pleased and so proud, and sent an email when I got home thanking Alistair Clarkson, not knowing whether he'd got there because of me or not. But when I next went, this was the end of January, early February, and when I next went to we had a break, of course, of supporter dinners over the break. So when, I think it was March, our first member and supporter dinner, and I spoke to Jazz, my contact there, and told her what I'd done. And she said, yeah, you hit it on the nail. You got the right address, and that would have been Alistair Clarkson. And that's how we found out about it. She said, but don't worry, he doesn't reply to anyone's emails. So it wasn't just you, it was everyone else as well. So, but I was just so happy. Can I just say one other thing? Some months later, and I'm thinking 6 or 8 months later, I was coming home from my rehab volunteering and called into our local Coles support supermarket, and the girl saw my label on my T-shirt and said, oh, are you a volunteer at Casey? And I said, yeah. She said, oh, my brother was in Casey some months ago. And I said, really? I said, oh, I'm on the rehab ward. She said, yeah, he was in rehab and his sister was there serving me at the checkout. And I was able to say, how is he going? And she said, yeah, he's doing really well. He's been very tired, but he's doing amazingly well. And he just said how wonderful it was. And I said, well, it was great. I said, I sent an email hoping that Alistair Clarkson would visit him, and he did. She said he still talks about that to this day. So it was just wonderful for me. I'd done the right thing and I cheered him up, and yeah, it was amazing.
And also just that experience of having that sort of, you know, down the track feedback to knowing not only did he know it at the time, but also it really resonated with him and stayed with him. Thank you.
Absolutely.
Thank you for that story.
Lovely.
Thank you for the story. That's great. And thank you for your volunteer work. I mean, you've seen huge changes at Casey, and we plan for some more. So hopefully you'll continue to travel that journey with us. Thanks for joining us tonight. It's
one of the highlights of my week, my volunteer work. I really love it. Can I say one very quick thing?
Of course.
New Year's Day 2022 will be my eldest son's 50th birthday, and he was born in Dandenong Hospital, and it'll be 50 years to the day on New Year's Day. So I've had a connection, but not realised the connection was going to link up later in my life. Thank you, everyone.
Thank you. So I'm going to ask Stuart Donaldson back now to announce the first of our 15-year length of service awards for our employees. Back to you, Stuart.
Thanks, Andrew. So, yeah, sticking with the 15-year theme, I'm now announcing the employees who have provided 15 years of wonderful service for Monash Health. Again, an outstanding achievement. And the recipients are Tommy Abraham, David Adam, Laura Aguilar, Sarah Ahmed, Christy Lee Allen, Karen Anderson, Benjamin Andrews, Cassandra Andrews, Merrin Angwin, Deodas Apanar, Simone Armstrong, Gregory Arundel, Sally Ayub, Susan Bagnall, Melissa Barbarich, Florenzia Barlin, Felicia Barrow, Amanda Beament, Natalie Beekhausen, Veronica Beggs, Karen Bailey, Rohini Banagarama Vinalaga, Agatha Bennett, Jessica Benjamin, Keithy Benjamin, Sarah Bennett, Kerry Benson, Anjali Bardwag, Christina Biancafiore, Anthony Birchall, Logan Bittinger, Kelly Blacklock, Merrin Blampede, Deborah Bly, Andrew Block, Ronalfo Bobares, Demika Bogadar, Felix Balanas, Johanna Bones, Hendrik Boetha, Lara Boyd, Christine Boys, Sarah Brass, Ross Bracken, Leanne Bradbury, Samantha Bradley, Sue Bretherton, Catherine Britton, Katrine Brown, Maria Brostek, Diana Burney, Roberto Calixto, Jane Cameron, Emma Canning, Daniel Carey, Linda Carpenter, Christine Casey, Gwendolyn Casey, Kim Castle, Lovely Castro-Mare, Kosol Chan, Wailing Polly Chan, Miang Charlson, Carol Charters, Yu Chen, Andrew Howe Chen, Amy Chen, Helen Chilton, Amanda Chippett, Charles Chong, Bon Chow, and Tracy Christo. Congratulations, everybody, and thank you so much for 15 years of wonderful service to Monash Health. Back to you, Andrew.
Thanks, Stuart. So let's just go back to that question I posed. You're travelled back in time to your first day at Monash Health. What would you tell yourself on that day? You're going to work with some incredible people and work on some incredible programs. Enjoy. Just go with this. It's going to take you some unexpected places. Nervous excitement. You'll like it here. Don't judge the book by its cover. This is one of the most innovative environments you could ever wish to work at. and then you made the right decision. Thanks for the feedback. We'll come back to this through the night. I've got a couple more questions for you. Actually, I'll tell you now, the next question I'm going to put to you is, what Monash Health moment lives most in your memory? So now I'd like to hand over to Louise Canis, our Executive Director of Public Affairs and Communication, who's going to announce the 15-year awards for employees. Over to you, Lou.
Thank you. Thanks, Andrew. And I really enjoy listening to the advice. I remember at my first length of service event, which is 3 years ago now, how much that advice meant to me being a new employee. So thank you for that. So I'd like to now recognise and thank the next group of employees who've dedicated 15 years of their working lives with Monash Health. Natalie Cincotta, Belinda Clark, Carly Clark, Katrina Clark, Andrew Coe, Kim Coleman, Phoebe Conception, Anessa Conquest, Emily Coote, Tony Cotter, Sandra Kropp, Augusto Cruz, Mark Cullinan, Angelina da Costa Silva, Lauren da Bera, Narelle Daff, Lauren Dalton, Chula Dulawat, Anna Davey, Cheryl Davids, Erin Davis, Annette Davis, Louise Davis, Teresita De La Rosa, Deborah Dell, Abanesh Demes, Karen Dennis, Sarah Donaldson, Geraldine Dugan, Margaret Dow, June Doyle, Joanne Driver, Anne-Marie De Silva, Yvette Duprez, Andrew Dial, Moira Eckel, Adrian Edward, Anne-Marie Edwards, Janice Edwards, Harry Ephemedes, Pamela Ellis, Faye Enriquez, Tracy Aronson, Nicole Fadul, Dennis Fenlon, Paulina Ferguson, Pamela Fernando, Andrea Fisher, Jacqueline Flanagan, Dana Flutzima, Joan Flynn, Gemma Flynn, Amber Frost, Gwendolyn Gage, Hermione Golbert, Susan George, Suji George, Jilsama George, Jennifer Gerber, Tony Jiang, Elizabeth Gibbs, Jessica Gill, Denise Gill, Jane Gillian, Louise Godbehere, Mark Golod, Marcelo Gonzalez, Dinesh Gunawanda, Carly Gordon, Renee Gregory, Yolande Grenfell, Anna Guerra, Hongli Gua. Thank you very much and have a great night.
Thanks, Lou. So many people with so many contributions. What Monash Health moment lives in your memory? I'll come back to this again in a minute, but this one is, for me, it's when we were asked to move out of our building to make way for a fever clinic, not knowing where we would be going or how we were going to operate, just that we had 4 hours to do it. I remember just how all the staff there rose to the challenge and got it done. The story, I think, of the last 18 months for many of us, hasn't it been? Other comment was the opening of the Children's Hospital, certainly a very momentous event in our long and rich history. So next up, I have the great pleasure of having a chat with Associate Professor Atul Malhotra. Atul is a passionate physician, passionate about improving the care and treatment of sick and newborn babies, both here and around the world. He's a very active clinician researcher focusing on improving respiratory and neurological outcomes for high-risk infants. And I often hear him talk about how privileged he feels to work at Monash. And I think we're very privileged to have him as part of our team, like all the people we've been chatting to tonight. Congratulations, Atul, on your years of service. So how did you find your way into the field of premature and sick newborns? How did you decide on that as a career path?
It's a very interesting question, Andrew. I'm very glad to be joining you. My wife is an obstetrician, and we met at medical school. And she told me that she loves obstetrics the day she saw her first birth. And she said, "Why don't you do neonatology?" So for me, that's the story, that I was actually lured into neonatology and preterm births by my wife, Arunas, who's also a Monash Health employee.
I understand that you and your wife are also do some work in developing countries. Is that right?
Yes, we run a program called One Sim, Andrew, where we basically bring all the people who do childbirths, which is obstetricians, midwives, nurses, doctors, whoever, anesthetists, into a education program using simulation. And we run that program in India, in Africa, in the Pacific Islands, and we also run it at Monash Health. In fact, we have one next week. And the idea is that if we train and we learn together, we will perform and work better together. That's our program, and it's been doing amazing work all over the world. And we're very lucky to have support from Monash Health, but a lot of other philanthropic organizations for that work.
Makes a great deal of sense, Atul. So you've been in your particular research area in the sort of cellular therapies space, haven't you? Can you just tell us a little bit about that?
Yes, that's a really exciting field of work. I'm privileged to work at Andrew, and that's thanks to a great facility we have at Monash Health, where we are co-located with the university. So I'm a university employee as well, and I work with the lab scientist, and I actually did my PhD at Monash University while I was working at Monash Health as part-time. And what we have done is we are moving cell therapies, which is basically harnessing the power of the cells which we have in a lot of our tissues, especially gestational tissue, which means that the tissue which is present during pregnancy and childbirth. We are using the power of those cells to try to improve the outcome of our preterm and vulnerable infants. So we are doing some really exciting world first studies, and I've been really privileged to work not just at Monash, but also with the whole campus on Monash and that facility which you said before, trying to be the best, not just in clinical care, but research. And I'm very privileged to be supported by the NHMRC on this as well. So Monash has been very lucky for me, and I look forward to many more years of great research here.
It's such an important part of our role, isn't it, Atul, is sort of not just service delivery, but also working out what the future service delivery might best be. And congratulations on the NMHRC fellowship, I think it is, isn't it?
Yes.
Atul, any particular memory jump out at you in your time with Monash Health that you want to share with the group?
So my son was born at Monash 16 years ago, and I was actually working on that night. So I was a neonatal fellow, and I was actually working in the neonatal unit while my wife was starting to go into labor. So I said, just hang on, I'm going to finish my shift at 6 a.m. or 7 a.m. and I'll be back home. And she said, okay, this is enough. Can you come now? And can you just take me to the hospital? So I carried my pager. I was living in Clayton that time, and we had just moved from the UK. And I said, okay, I'll come over. And at 7 a.m., I actually told my consultant at that time, can you take over my pager, because I think I can't look after the babies anymore. I need to look after my wife. And it is funny, my wife actually needed a pediatrician at birth, and I told the obstetrician, don't worry, I'm happy to look after my own child. So that is my very funny and memory which never goes away, that I actually not only looked after the babies at Monash, I also looked after my baby myself at birth. So really exciting.
That's a great memory, Atul. And look, thank you very much for joining us, and thank you for everything you're doing for today's patients and also tomorrow's.
Thank you so much, Andrew.
Thank you. On a similar theme, it's a great pleasure to introduce Professor Rhonda Stewart, our Medical Director of Infection Prevention and Epidemiology, to announce the next group of 15-year award for our employees. Over to you, Rhonda.
Thanks, Andrew. It's so great to hear those little stories from our employees, and I'm really happy to announce another lot of 15-year length of service awards. The first one being Emma Geimer, Mariana Habarakada, Marianne Hall, Joseph Hannafin, Melissa Handjukic, Astrid Hansen, Gwendolyn Hansen, Lisa Hardman, Laura Harrison, Ahmed Hassan, Samantha Hennessy, Dennis Heikart, Joanna Hicks, William Ho, Kylie Hodge, Charlie Hafilamina, Sally Ann Honan, Tarian Hong, Kim Hugerworth, Kylie Horn, Hong Hu, Deborah Hunter, Samantha Hutchison, Andrew Jackson, Rajani James, Linny James, Charlene Jantz, Linda J, Emily Johnson, Robert Jones, Gail Jones, Teresama Jose, Preetha Joy, Monica Joy, Liliana Junkaru, Sijina Kakapor, Eva Karanja, Rima Katz, Harkeet Kaur, Joshua Kausman, Sally-Ann Keast, Andrea Kemp, Sally-Ann Kempler, Sarah Kendall, Amanda Kendall, Sharon Kent, Abbas Kambati, Ratha Cott, Judith Kidd, Rebecca King, Ananda King, Tanya Kirk, Eileen Coe, Joanne Koch, Maureen Koo, Melanie Kochik, Belle Covell, Doron Krantz, Stella Kravstoff, Bina Kumar, Gabrielle Kwok, Nori Lakesta, Zine Lagui, Joanne Lake, Tammy Lamack, Adam Lamendola, Mary Lufu, Afoe Leoane, Michael Lee, Tulek, June Lee, Andy Lim, and Thea Lim. Congratulations, everybody.
Thanks, Rhonda. So I'll go to some comments and questions. It's great to see how far we've come. This video is a great reminder. Congratulations, everyone. Congratulations, Anula. 15 years. 15 years, what a great achievement. And the last 2 years have been during a pandemic. So proud of everyone at Monash Health. Elaine, thank you for going to great lengths to help our patients. You definitely make people's day. A shout out from one of our board members, Aurelia. Congratulations, Elaine, and to all our wonderful volunteers. Thank you for the difference you make every day. Elaine, you're a legend. Elaine, a lovely story. Thanks for everything you and your wife do for babies and families at all. A real asset to Monash Health. Congratulations on 15 years. There's some lovely stories there and lovely comments. Thank you. We took the opportunity to ask some of our longest serving employees a few questions about their experience at Monash Health, and this is what they had to say.
I would describe my role as running the operations of Monash Children's Hospital together with the various leaders of the organisation, and that's to ensure that we provide the best possible care to our children and their families.
I would explain my role as trying to change Monash Health in a way that we can respond better to people who are experiencing family violence.
I established the early neurodevelopment clinic at Monash, where we actually diagnose our sick babies with conditions like cerebral palsy at a very early age. That gives us the opportunity to help these babies and families achieve their best potential going forward.
The way I describe my work to others is that my passion is with children. For the last couple of years, I've been working with the babies in the children's in the canopy ward.
My main job in Monash Health is to photograph patients and their medical conditions as part of their treatment or for teaching or research.
I've loved nursing for 30 years and it's something that I love because I can make a difference. I would say some of my favourite memories come from the paediatric ED. I have lots of little children who would be so upset, but when you join them, all of a sudden they calm down, they become happy. I've even sometimes had a little sing or a little dance with children, nursery rhymes, and all of a sudden you make their day.
My favourite memory is the silly times when people were celebrating an event or getting together.
One was as a student when I cared for a gentleman who had suffered a stroke and he was unable to speak as a result. He eventually was able to say, I will walk out of here, and I had the privilege of walking him out of the hospital on discharge.
My favourite memory at Monash is the birth of my own child 16 years ago. Monash is a very big place with a lot of departments and a lot of other facilities on site. So please go exploring Monash and try to talk to as many people as you can and work with them. It's a fantastic place to be.
Embrace new changes and challenges and opportunities.
Become a friend of a ward clerk because they know the ins and out of the hospital.
That's a huge question. I'm most grateful for the people I've worked with. I've had some amazing leaders, mentors and teams that I've worked with. And I'm most proud of the care that we provide to our patients.
I guess I'm most grateful for the stimulation of the environment and the mental challenge that it's given us working here. Because it's so challenging, it's also very stimulating.
Over my time here at Monash, I'm most grateful of the support and respect that I've received as a professional, that I'm part of a team and that I'm involved with teamwork. It's fantastic.
I don't think I ever dreamed that the pandemic would be as severe, nor would it go on for such a huge amount of time as it has.
What it's taught me is how vulnerable we actually are, but it's also taught me how flexible, agile and resilient we can and are being.
It just goes to show if we work together, we deliver awesome outcomes that affect the whole community.
COVID has taught us to be flexible, to be respectful and to be as patient as possible.
It has taught me quite a bit about life, even at my age.
There's not one word I could describe my colleagues. They're awesome, they're inspiring, and the support I receive from them every day, both on a professional and a personal level, I'm really grateful for.
They are dynamic.
I would say they are very friendly.
The one word I would use to describe my colleagues is dedicated, but I think that dedication shows all the time.
One word I would describe my colleagues is brilliant. What brings me back to work every day and to Monash Health is that I truly believe we are making a difference in the patients that we care for and their families.
One of the special things about Monash is that I not only get to practice the medicine, the education and research I am so passionate about, but I also work with my wife, Associate Professor Arunas Kumar, who is also a partner in crime. So I'm really privileged to work alongside my wife in this Monash happy family.
The children are the ones who are important, and if I can make them happy, make them smile and laugh, this is all I can ask, and I go home happy.
What a great video, and as someone says on the Slido, I could watch this video again and again. Thank you all. And Vesna, you are inspiring and love the slideshow. And I am going to ask you all your next question, which is what Monash Health moment lives most in your memory? I'd now like to invite Luke Hannes back to announce the next group of 15-year awards for employees. Over to you, Luke.
Thank you. Thanks, Andrew. I've seen that video a few times, and it still makes me emotional. And it's just a reminder that behind every one of the names that we read out is a story of someone's journey and time with Monash Health, and for that we are thankful. So the next group of employees who have served Monash for 15 years are Jinky Linero, Suzanne Little, Juani Louis, Su Ying Louis, Madalena Louis, Simon Livesley, Celeste Lowe, Catherine Lombardi, Liang Louis, Joseph Liu, Yafeng Liu, Fatima Lumenboski, Jeanette Luscombe, Liana Lai, Bridget Lynch, Bernard Lynch, Joanna Lyon, Mercy Madisthea Abraham, Vicky Maddox, Margaret Mamelis, Mathavi Mavida, Margaret Mayen, Patrick Mack, Mordy Makota, Atul Mathora, Thomas Mainley, Tia Maria Katrina Mark, Carol Martin, Karthnik Marathupili, Meredith Masquetta, Lisa Mason, Maria Matheson, Maggie Matthew, Linda Maxwell, Glenda McLean, Diosi McCallum, Melanie McCann, Mika McDonald, Claire McGill, Robin McInnes, Renee McLaren, Brian McMillan, Siobhan McNally, Lenora McNeilage, Suzanne Meadows, Teresa Micklem, Alistair Mayer, James Mayer-Grieve, Kira Makalova, Kirsten Milner, Nisha Milton, Felice Manpu, Joanne Mockler, William Moyer, Fiona Moore, Laura Morrill, Emma Moros, Jacinta Morrow, Senziwe Montagna, William Mully, Louisa Musara, Phineas Mutiz, Malcolm Myers, Michelle Naidu, Naomi Nasay, Cynthia Navaranti, Nora Nkube, Peter Neal, David Nguyen, Wendy Newworth, Gillian Nixon, and Margaret Jambi. Thank you and congratulations.
Lou. So, that next question. What do you still want to achieve at Monash Health? And comments I've already got from the last question. It's always about the great people, and we get to see a few highlights just here. And I think a similar comment to what Lou made, which is so emotional to watch the video, and our dedicated colleagues. So I now get to introduce Martin Keogh, our Chief Operating Officer, who will announce the next group of 15-year awards for our employees. Over to you, Martin.
Thanks, Andrew, and what an inspiring night. As always, it's such a breadth of roles that our team do every day that create the care that we provide to our patients. And it's nights like this that we get to see the breadth of opportunity for people to work in healthcare and provide this care. And equally, what always comes out here is this sense of the Monash family, and literally the Monash family. When you hear about Atul and his family and his child being born here, and Elaine the same, some 50 years ago that her son will be born in a couple of weeks. It's such a family. We're so connected to our community and each other in so many ways. It's a great night. So I've got the pleasure of introducing further 15-year recipients, and the first one is Rebecca O'Gorman, Sky O'Grady, Julie O'Keefe, Po Ong, Chu Ong, Sasha Ozawinki, Ben O'Sullivan, Patricia Ann Otter, Roderick Palentino, Joy Palati, Beryl Palawinkas, Toa Parker, Jacqueline Parkinson, Desmond Parsons, Rosalind Patterson, Wyeth Poole, Marie Paul, Monique Pedetti, Mesra Paduk, Irina Pidler, Tracy Percival, Tanya Pereira, Nalin Pereira, Hung Fan, Lizzie Phillip, Gurusilla Peninto, Asha Peninto, Robert Ponsford, Glenn Porter, Kelly Poutney, Sandra Powell, Teresa Powell, Kritney Prakash, Nicole Pratt, Michelle Purtle, Serena Kuma, Willif Raffner, Wythor Ramman, Susan Rankin, Paul Ratcliffe, Dilupkumar Ratnama, Bal Raw, Jessica Renfrew, Sharon Richardson, Marianne Roberts, Emma Roberts, Marianne Robinson, Suwani Rodrigo, Barbara Rodriguez, Nezra Rossetti, Gilhan Siddiq, Marie-Luce Samar-Chiti, Benjamin Samuel, Romana Santier, Jeffrey Santos, Karen Sawyer, Leticia Scarlambra, Matthew Scott, Blake Scott, Carmen Scully, Lourdes Scurry, Ree Silk, Icy Sebastian, David Sheffield, Bernice Sheridan, Bing Shi, Rima Sogel, Apa Shaman, Deirdre Short, Astrid Shuri, Claire Shooter, Kangrana Shia, and Elizabeth Sixton. Congratulations to you all. And Andrew, it's gone past 6 o'clock and I think I'm officially off duty. So I've got a drink here and I'm going to cheers to you all. And as per our premier, if you are inclined to dance, you can go out and dance tonight after midnight.
Thanks, Martin. Just remember, you got to get back up in the morning. Andrew Coe has been a nurse manager in the ICU, but his current role is very different. Andrew is now in charge of procurement and distribution of clinical products for Monash Health from our Scoresby Distribution Centre. And at the moment, that also means for the whole of the state when it comes to COVID-related material. Through his 15 years with Monash, where he started his career as a graduate nurse, it's been a very interesting ride, I understand. Let's have a chat to Andrew and hear what he's got to say. So 15 years, Andrew. Firstly, congratulations. And second, tell us a bit about what prompted you to take on such an extraordinary move into the distribution centre. I suspect you didn't think you were going to be in the pandemic at the time, did you?
I did not, Andrew. An opportunity came up to help work with some of my colleagues to make sure we get the right products, and it seemed like something to do. So I sort of jumped into it. Seemed interesting.
So what?
And then the pandemic hit.
Yeah. So just for everyone on the call, I guess that's you know, we've got a wide range of backgrounds and experiences. Tell us a bit about actually what you do. You know, what does you do in your role?
Sometimes it can be very simple things, just looking for clinical products. To someone comes and says, I need a new piece of equipment. Doesn't matter, could be a ventilator, could be an N95 mask, could be anything really. Or we get asked to review whether this product is current best practice in evidence. So we go and work with some of our peers, our surgeons, our pharmacists, our allied health team, and work out whether there's a better option for us as an organisation. And that's sort of what we traditionally did with, evidence-based research, and see what products there are, and then how can we get them into the hands of our clinicians, because just because something's available in theory doesn't mean it's actually available.
I'm sure you've had some very interesting requests, Andrew, during this time, but how's the pandemic really changed your role? How's that experience been for you?
Yeah, it's been very interesting. We really pivoted away from our business as usual stuff, and that unfortunately meant that some of our normal services we had to scale back a little bit. We had to focus to make sure that we had the right protective apparel for all of our staff, which meant huge volumes of N95 masks, isolation gowns, hand sanitizer, even basic things like needle syringes, oxygen masks. These are all made overseas, and when all the supply chains around the world started to suffer a bit because of COVID and COVID-related factory shutdowns, we had to sort of find alternatives for us to just keep doing our daily activity.
It's been an extraordinary time, Andrew, hasn't it? Such a reliance on the work that you and the team have done in the warehouse and distribution centre. I think it's been quite remarkable, and a great contribution by Monash Health. But of course, the last 2 years aren't the entire 15 years. Do you have a particular memory that you want to share with the group tonight?
Yeah, I remember looking after quite a few patients through ICU over the years. I remember the last sort of mini pandemic during swine flu, when we were all very scared, and it sort of primed Monash, I think, in a way. We sort of practiced a bit. Probably my favourite memory though was when we opened the children's hospital, and I had the privilege of being involved in the care of a child who had a rather poor outcome, but the family, the work we did with the family, and we were able to get this poor child passed away, but we were able to get the family to cuddle this child in a bath, which was their last request. They just wanted to sit in a bath with their child and have a cuddle with them. And we managed to do that. And even though the children's was still nearly finished, it hadn't actually been completed yet. And, the team pulled together within the ICU and the pediatric ICU, and, Kim Forrest, who was the general manager of the hospital project, she moved heaven and earth to get, just to fulfill this last request for a child's family. And it sticks with me as the efforts we would go to support a child.
It's a great memory. It's a great reflection, I think, of what we do in healthcare, isn't it? That sort of core principle of treat many, cure some, and comfort all. So nicely captured in what you've had to say, Andrew. Thank you for joining us tonight, and thank you for all the work you've done at Monash Health. Great. I'm sure Katrina's very proud of a graduate nurse who's now having such an impact on the health system.
Thank you, Andrew. Thank you all.
Thanks, Andrew. So let's go back. What do you still want to achieve at Monash Health? I'd eventually love to introduce infant massage into the neonatal intensive care unit, a way of positive touch and parent bonding. I'm not sure about this next one. I'm a bit worried about reading this next one, because I think at my next board meeting I'm going to be asked for the implementation strategy. It's world domination through compassionate and empathic patient care, and supporting new nurses coming through our programs to do the same. There was another comment that said, world domination, what else? I'll have to think about that one, but I love the second part as well. Even as after 15 years, there's so much more to explore and achieve. Congratulations, everyone, and thank you for all the hard work over the years and continuing to support each other. I still have so much I want to achieve, both personally and professionally, but I look forward to another 15 years. Thanks, Louise, and all the PAC team for organising such a great night. To work with some of these other inspiring people, always something new and innovative happening, and opportunities everywhere. To help my junior colleagues to get the most out of their career here at Monash Health and help as many members of the community as I can, and to work with some of these inspiring people. Always something new and innovative happening and opportunities everywhere. Well said. So now I'd like to invite Professor Stewart back to announce the last group of 15-year awards for our employees. Rhonda.
Thanks, Andrew. And wow, some of these stories that I'm hearing about just reminds me of what Monash is all about, and just that special touch that seems to happen so often at Monash, which is amazing. So 15-year employees again, the last of this lot tonight. I want to announce Shubhi Singh, Vinay Singh, Reshme Singh, Gauri Sinapu, Anula Sirapala, Megan Sawaradeen, Siva Sivananthan, Catherine Skinner, Christine Slatter, Peter Smith, Shantha Suri, Dean Spilias, Sharon Spreckley, Mina Stamos, Renee Stanley, Sandra Steen, Katie Steen, Beth Stephen, Amy Stitchling, Kathy Stepanovic, Vladimir Stepanovic, Durda Stupar, Rosemary Summer, Joanne Chabosky, May Tan, Susan Taylor, Bernice Tay, James Tanoof, Jodie Tanoof, Lisa Terry, Philip Thomas, Elizabeth Timms, Luke Tomateo, Balatio Token, Arthur Toliopoulos, Anna Topakova, Joanna Tozer, Isabel Truman, Frank San, Fane Tufa, Pak Tung, Christine Turnbull, Brooke Valaburn-Hayer, Leah Vanchina, Ivana Vargovich, Adam Varsafal, Rebecca Verel, Catherine Verscharan, Ivana Veskofi, Nina Vong, Catherine Vals, Anna Vranka, Dan Vu, Lisa Wallace, Catherine Walsh, Narinda Warriach, Dorota Barrios-Esca, Joseph Waterstone, Valerie Wethen, Gareth Weston, Sonia Wong, Audrey Wong, Fiona Wright, Amanda Wu, Lorraine Wires, Jaming Young, Vincent Yap, Leyland Yeh, Teresa Young, Diane Young, Sarah Young, and Sylvia Zarkis. Congratulations, everybody, and thank you.
Rhonda. So let's go to some comments and questions. Teresa Malcolm, thank you. Unit 2 Nurse Manager, what a champion. Thanks to our executive, genuine thank yous and beautiful backdrops. I'm looking at you, Stuart Donaldson, is the comment. Thank you, Andrew Coe and the distribution centre team and all the support services and office teams. We couldn't run the service without you. Never a truer word said. Thank you, Andrew Coe. A really moving story. People like you make the place tick. So that was 441 people. This year we recognised over 1,500 people for reaching milestone lengths of service at Monash Health. I want to thank everyone we've recognised tonight for their extraordinary dedication to our community and for choosing to work in our wonderful organisation. I hope you're as proud of your remarkable contribution as I and many others are to work with you. I want to leave you with a final simple message. This video we're going to show you at the moment contains a few familiar names and faces. We wanted to end by recognising in particular the last year of incredible commitment from you all, our people, and to let you know how very grateful we are. Congratulations and thank you on your service. It's an extraordinary time. I hope you enjoy the video. We had a lot of people wanting to say thanks, and this is just a few of them.
On behalf of our government and every single Victorian, I'd like to send my sincere thanks to everyone over at Monash Health. From our frontline medical and nursing staff to those in the back office, the work you do every single day is the very reason Victorians are getting back to the things they love and have missed so much. Over the last 20 months, you've all had to give so much of yourselves, whether it's wearing PPE from head to toe, working back-to-back shifts, or missing out on time with family. You have sacrificed so much in the service of others. Now, I know that none of this has been easy, but please be certain that we are all so grateful for everything that you've done, for everything that you've given to keep our state safe. Thank you.
What a year it's been. Thank you to the entire Monash Health team for your amazing hard work.
Just wanted to say a huge thanks to all the hard work that Monash Health staff, the doctors, nurses and the many others have been doing during this pandemic and will continue to do in the difficult weeks and months ahead. You guys are just incredible.
Thank you to all employees at Monash Health. Thank you for your hard work and dedication shown to all the patients you have cared for with COVID-19 over the last 2 years. My work with Monash Health has shown that the employees are fantastic collaborators, they're can-do people, and they're excellent team players as well.
Monash Health was the first health service in the country to diagnose and treat a COVID-19 patient in Australia. And since that time, you have been at the forefront of our COVID response, looking after patients, responding to significant outbreaks, but also looking after all the other amazing requirements of the people during this pandemic. Monash is an extraordinary health service. Its staff are dedicated, well connected to the community, and you've done so much for our nation. Thank you.
You are all truly extraordinary. So both personally and on behalf of everyone here at the department, thank you to each and every one of you for everything that you've been doing for our community for so long now. Your skill, your expertise, and above all else, your kindness have kept Victorians safe.
Thank you to all Monash Health staff for what's been an incredibly challenging year this year.
To the whole team at Monash Health, just a massive thank you. Not only for being part of vaccinating 5.3 million Victorians, but for the care and passion and dedication you show in everything you do every single day. At a personal level, thank you for vaccinating not only my wife, my 2 children, but also myself, and every encounter I've had with your amazing team has just filled me with so much warmth and delight.
On behalf of your colleagues at Jessie McPherson Private Hospital, I'd like to say thank you for your dedication and support throughout this past year. Especially want to thank the many Monash Health teams that have supported and partnered with us in delivering excellent private hospital care.
I am proud of the Monash Health community team's response during COVID, caring for some of the most vulnerable people in our community. This shows great dedication to helping people to live their best lives.
Thank you to all employees at Monash Health. I'm so impressed with your dedication and teamwork.
What we've achieved has been extraordinary in how we've cared for all of those who need our help in this most challenging of time.
Your dedication and commitment to providing care, support and comfort for our patients is so appreciated by our patients and particularly by your colleagues.
More recently, my parents acquired COVID and were monitored by Monash Health staff. The care provided to my parents was second to none. I also had my son in for a broken finger a few months ago, and the bedside manner of all staff was exemplary. I'm proud to be a part of, and it is times like these that remind me of why I choose to spend my days at Monash Health. I'm very proud of you and this organisation. Thank you.
A million thanks to our fabulous Monash Health community. Your flexibility, agility and capability to work through difficult times is absolutely awe-inspiring.
What's been most outstanding for me about Monash's response is our ability to adapt to the constant nature and changing nature of this pandemic. We now have such a pride in our organisation because of what we've been able to do and how we've been able to contribute and how we've protected our community. So thank you all.
Unexpectedly, you cared for my father in the final days of his life. I will be forever grateful for the professionalism, care and kindness you showed Dad and my family. To work with you, to call you my colleagues over the course of the pandemic has been an immense privilege.
I would like to thank the entire financial services, procurement and logistics team for continuing to service the entire organisation, in particular to warehouse and deliver PPE across the entire state of Victoria. They've shown a fantastic resilience and determination to get the job done. Thank you.
Congratulations, and thank you very, very much to all of you receiving awards, but to all the nurses and midwives at Monash Health, a very big thank you.
You should take great pride in the powerful impact that you have made to the communities we serve.
You've been amazing in the way you've come together, always showing up, always willing to work outside your comfort zone, and always being there for your patients and colleagues.
Be proud to be a staff member at Monash Health because we are very proud of you.
I'm grateful for the teamship that I've seen and most proud of how we have worked together with respect and kindness.
I would like to thank you all for all your hard work, flexibility and adaptability, professionalism and kindness that you have not only shown to our patients, but also to each other. I'm very proud of the can-do attitude from everyone, without which we could not have achieved the great things I see every day.
I just want to express my enormous gratitude for all the work you've done, especially in this last year, but really over a long period of time. It's been an extraordinary effort. It continues to be an extraordinary effort. I think those who aren't there at the front line don't understand just how relentless and challenging it has been and continues to be. Thank you so much for all that work. You've got us to this point in time. You'll get us through some challenging days ahead, but hopefully we're looking at 2022 where we can all look back with enormous pride on what's been achieved, the lives saved, the care that's been given, and you are absolutely at the centre of that, so well done. And again, thanks from me and the entire public health team. Cheers.
Thank you for all joining together to support each other in the last 18 months. It's been a huge journey, and I'm very proud to be working with every one of you.
I really wanted to call out and thank all of you for the extraordinary work you've been doing. Your resilience, your professionalism, your patience, and willingness to be flexible and be part of the team.
It has been a year like no other. As the health service responded to the COVID-19 pandemic, you have adapted continually. I'm proud of every member of our Monash Health team. You continue to deliver the best of care under the most challenging times.
Thank you. Thank you.
Thank you from the library.
Thank you. Thank you. Thank you.
And thank you for the commitment that you've shown to the people.
Thank you.